Welcome everyone to today's webinar. I am Lauren with Becker's ASC Review. We will begin today's webinar with a presentation and we will have time at the end of the hour for a questions and answer session. You can submit any questions you have throughout the webinar by typing them into the Q&A box you see on your screen. We look forward to hearing your questions. This session is being recorded and will be available after the event. You can use the same link you used to log into today's webinar to access the recording. At this time, it's my pleasure to start today's webinar by introducing our presenters. Damien S. Berg is Regional Sterile Processing Manager at UC Health. Jeremy R. Ralston is Facility Engineer and Safety Officer at San Luis Obispo Surgery Center. Brandon Coombs is Vice President of Business Development at Surglogs, and John Castro is Product Development Manager at Surglogs. At this time, I am pleased to turn the floor over to John to begin today's presentation.
Hello, everyone, and thank you for joining us today. As Laura mentioned, today we're going to be talking about the benefits of digitizing regulatory compliance processes. And what we talk about that when we're describing that is anything that the federal government or any state governments are mandating that your healthcare facilities do and document. Most of those practices are done on paper. So we're going to talk today a little bit about the challenges with traditional practices versus moving over into the digital space. So to start off, we're going to, as she mentioned, she described our presenters today. We've got Mr. Damien Berg and Mr. Jeremy Ralston joining us today. And then I am John Castro from Surglogs, and we also have Brandon Coombs. To start, Damien is going to describe some challenges in the sterile processing environment.
Thank you, John, and thank you all for being here today, doing this presentation. And for those listening on the other end, I appreciate you as well. My journey, I've been doing sterile processing for 28 years, and I've been through numerous regulatory surveys, numerous State Department of Health audits and surveys, and I also traveled not only just around the country, but around the world, visiting hospitals and sterile processing departments, both in a consulting type of role, but also just touring and being able to see them and share my experiences. Been very lucky that way, but as an operational manager of 2 large facilities and a surgery center in northern Colorado, I'm pretty busy. I'm all over the place. So I go from hospital to hospital. I visit different areas in my hospital, and one of the things that has always challenged me is the ability to see at a moment's notice all the logs, the dozens and not hundreds of logs that a sterile processing department and a hospital really honestly has to maintain, both for simple things like temperature checks in your department to washer verification tests to many different sorts of audits. I even had the opportunity during the COVID time to use Surglogs to document our N95 mask reprocessing and other COVID-related tasks that we never did in sterile processing before, but I wanted to be able to show the work, but also track the work for any future questions or concerns. Compliance is very interesting because, again, when we talk about the regulatory people who come in and look at your departments, they're looking for very specific things. But one thing they look for is variation. And as we know, when we're dealing with humans, we often have our own little flares, our own little tastes of how we document things. And I've seen surveyors get to the point of if someone's doing a line through a whole regulatory checklist, or they do a checkbox, or they scribble the box out, or however they want to do it, where they put the date and time, the month and the day and the year, all that, if it varies from sheet to sheet and log to log, causes them to start asking questions and start digging a little deeper. That's what's nice about having the consistency of a digital platform, so I don't have to worry about the human effect to the logs. And then again, what's really nice is, again, I'm sitting at one of my hospitals right now, but I can actually log on my phone or on my computer and see, did my other hospital 20 miles away do the logs for that day, or they got upcoming ones. And if they hadn't, then I can reach out to that department leadership and say, hey, what's going on over there? Or if they had a failed log for whatever reason, maybe a piece of equipment's down and not working, we can initiate some remedies for that as well. And then more importantly is what I really like is escalation. I need to know what the fallouts are. Is it because of human error? Is it because of machines down? Is it because of workflow disruption? What is going on in my departments that they're not able to complete their regulatory logs? And it could be very simple as I just didn't get to it yet, and then we can start having those conversations versus we got some major problems over here, and I need to know about it, and I will know about it by logging in, simply looking. But really important is also showing the staff our education and return demonstration of the different type of logs that we have out there. So again, it's not just knowing that I got to say yes to a digital log or write it on a piece of paper log. It is understanding why I'm doing it. So manufacturer's instructions for use give clear guidance what needs to be done with certain pieces of equipment. The staff don't just do a checkbox. They actually have to understand that because we've put the IFU steps into Surglogs. So it's not just simple, I did this task for the day. I've done all these tasks in this order according to the manufacturer. So we're putting the knowledge and the why behind the log. And that's why really important for me as a leader in this field. And that's the story I wanted to share. So I'll pass it on now to my colleague, Jeremy.
Awesome. Thank you, Damien. And to start off, before Jeremy gets started on his part, we'll talk a little bit about some research that we've done into life safety challenges. So that's our next topic is life safety. And what we found is 20% of facilities pass with absolutely zero life safety discrepancies. It's one of the most common areas for discrepancies, and this is according to data published by CMS. And if you want to take a look at what those percentages by deficiency are, you can see them on the screen here. And most of these really have to do with documentation and creating workflows behind getting all of this maintenance done and making sure hazardous areas are taken care of. Most of this stuff has to do with making sure it's all done on time. And so Jeremy's going to talk a little bit about his challenges and how he's overcome them. Jeremy?
Good morning, everyone. Thank you for giving me this opportunity, and thank you for pulling up on us. So with doing life safety, I've kind of gone through this, and we all follow the same regulations and same policies pretty much across all the companies I've worked with. I've been doing this for quite some time now. Just every facility has different practices on this. What's nice about this is we all follow the same, but it gives us a quick reminder of exactly what we need to do and the standard we need to do it. Like Damien was saying before, it takes out the human error of it. It kind of puts it into a straight log system. The best part that I like about the digital part of it is you can set it up for your reminders, your drills, your maintenances, your trainings. Everything pops up, so it gives you that exact time limit because, like your fire drills need to be done every so often, so it's every quarter, and they need to be done at different times. And it's quick and easy to pull up on my Surglogs where I can pull it up when it gives me a reminder that I need to, what time I did my last one so I can make sure I can vary that time off. So this has also helped with my vendor compliances. So my people that do my fire alarms, my sprinkler systems, it's really helped out because they know what my standard is. I put it up, they go through the checklist, and it makes sure it has everything there that Joint Commission or AAAC or CMS want to see. So it's made it very, very simple, and I've actually put other tasks into it that help me get through my day where it took me usually a few hours per day over several days to go through everything. And now it takes like 1 or 2 hours just to kind of go through, do my checklist. And if I get interrupted, I can stop, help those people, do what I'm supposed to do. Like we all get interrupted, through the day with patient care or something like that as we're going, because that's priority in what we do. And then we go back to our job and our task. And it's very simple to be able to pull it up on my tablet or on my phone and just keep going with what I'm doing. So, and instead of having to walk around with a binder or a clipboard, it makes it very, very simple. So, and it also makes surveys very, very easy.
And Jeremy, if I could follow up and I can ask you, with all the varied time frames of all the different tasks in life safety, you've got weekly generator checks, quarterly drills, biannual drills, all that good stuff. What was your process like before moving into a digital system? How would you keep track of everything?
Honestly, it's a little bit more difficult because you were going through, your logs, having to remind yourself, set up reminders on your phone or on your email to go through and try to check all this stuff. Where now, instead of me, it takes out the human error like we were talking about before, where it's as simple as pulling up oh, look, I need to do this today, and I can knock it out really, really quick.
Okay, awesome. And thank you, Jeremy, for talking a little bit about life safety. On our next topic, we're going to talk a little bit about infection control. So of the Joint Commission surveys in 2018, 52% of surgery centers and healthcare facilities were cited for IC 020201, which is the reduction of infection risk from equipment, devices, and supplies. So infection control is really, really difficult, and it's really, really redundant. And so if both of you could talk a little bit about the challenges you face in your infection control programs and how you overcome them.
Yeah, thanks, John. I'll guess I'll go and give it a try here. Yeah, infection control, as far, especially with the Joint Commission surveys, everybody knows that there's, you know, some hot buttons, or should I say low-hanging fruit, that they like to go after. And in the infection control sections of the audit, sterile processing or high-level disinfection and cleaning of devices is one of their top citations. It is what they constantly find, and they find the same things over and over again in the hospitals they go cite. So I know, for instance, I'm in the Joint Commission window right now, and we're doing tons of mock audits, as everybody always does when they're in these. And again, it's really nice that when the auditor comes in, both internal and external auditors, you know, I pull up the log and I said, you know, where do we want to start? Whether it be our education, our competencies, whether it be are you following your manufacturer's IFUs? Let's check a look at your maintenance on your equipment. All those now are in one spot. So I don't have what I usually affectionately call the crate of knowledge. It was basically a crate of binders and books we put together for an auditor that had to be constantly updated and changed. Now, majority of what I give them, I search easily. I let them search, or we print off exactly what they need on this type of thing. You know, that's at least my perspective right now on that. So they look for those hot button areas that every hospital has, because that's what they keep finding. And if they keep finding, they're going to keep going after them until that reduces. And so that's one thing that having the digital logs to eliminate those low-hanging fruit opportunities really comes in. And as we know, most surveyors, and I think Jeremy hit on this a little bit, once they start knowing that you have your stuff together and that, you know, they're getting their questions answered accurately, quickly, and it's in a very professional, you know, it's not just a bunch of papers thrown around, they move on. So they kind of leave you alone because they're like, this is no fun for them, let me move on to the next task. So giving them their answers and getting them what they need quickly so they move on and go out of my department is one of my top goals.
I completely agree with you on that, Damien. I mean, even like the hand hygiene compliance log that we have, it's actually made it quick and easy for our infectious control nurse to be able to go from nurses all the way from pre-op, PACU, all the way back in the OR, including surgical techs and physicians, where she can do a quick 30-second log instead of having to run down and find paper. She can just do it quick on tablet and keep on running. So, I mean, and it has made it so much simpler for when the surveyors come in. We just went through a survey, and I put the whole thing in front of the surveyor, and what normally takes half a day took us a couple hours. We were done. We were back on our walkthrough.
Yeah, outstanding. John, can you do the next slide, please?
Of course.
So again, I'll kind of
here.
Go for it.
Yeah, I was just going to open up and say, you know, when looking at traditional versus digital regulatory compliance tracking, what are the biggest differences that you guys see?
Yeah, I mean, Jeremy and I've kind of hit on this a little bit right here, but, you know, especially with the first two bullet points, you know, finding instantly what we need and simplifying the process. One thing that I went through is, you know, and I'm sure everybody can relate to this, is we actually had another person in the hospital who would be the go-between. So if the surveyor asked us to see certain logs or certain documentation, I would produce them, but I would hand them over to this other staff member, usually administration type of person or a regulatory quality person, and they would review and spend time making sure it's all complete, making sure it's what they asked for, and then they would hand that to the surveyor. So it was just another person in the mix trying to do stuff. This has eliminated that person because the logs are there. If they're not accurate, it's going to give you that color, the red, yellow, green, to tell you what you need and why it's not accurate. And again, it creates really nice workflows for our staff. Jeremy talked about it earlier, where he sets up the tasks and the staff go do them, and that's exactly it. And it becomes that knowledge-based thing, that comfortable level thing. I mean, in the beginning, getting used to a tablet in the department and going to the logs was something I had to follow up on daily. Hey, make sure you're doing it, make sure you're doing it, and I can see if they're doing it or not. Nowadays, honestly, that's one of the first things they do. They jump in the morning right after shift report and they start looking at their logs and seeing what's due today, what do I got to do, what's upcoming. It's really changed the staff's workflow, and it's really, really nice. And there's a couple other things that I want to highlight. It also forecasts stuff for you. So, for instance, we have an air dryer in our department that requires filter changes every so many months. It's a HEPA filter change. Well, instead of me waiting until the HEPA filter, it's changed and then I got to order it, I got to keep a bunch on supply. Again, it's all about dollars on hand. I get an email like a month before the filter's due from Surglogs saying, hey, you got 30 days till you filter change. At that point, I can order then. So again, it's changed how I do my workflow, because I don't have to either order last minute and pay for extra shipping, or I don't have to order a bunch ahead of time and not only spend the money when I don't need to, but also storage space for those. So it's really reduced my process steps, my workflow on how I interact with it.
I completely agree with that. I mean, it's made just going over life safety and the generator logs, and even with the vendors going over their notes as they do stuff, instead of them having to truly check out with me, I can look over the log and just give them a quick thumbs up, say, hey, have a good day. And it's made our flow go a whole lot simpler just through the day itself.
Yeah, I mean, I think, one of the big things that we talk about is reducing the process steps. You don't, it becomes second nature for me to log on at certain time points during the day. I can set little task reminders in my calendar and say, check it. But honestly, it's second nature now to me to check my staff, and they know I'm checking too, because it's nice to be followed up. I always use the analogy of if you have kids and you tell them to clean the room, but you never go check the room, obviously it's not going to stay clean, or it's not going to be cleaned. So with my staff, they know that I'm checking, because I can be literally 20, 30 miles away, and I'll call them and say, hey, I checked the logs today, how are we doing? Or, hey, good job on the logs today. I see everything's been completed. Anything you need from me? They now know that it is an expectation, but they also know that I'm checking. Before, I'd have to be on site to actually check. And with the immense amount of meetings that we all have nowadays, saving process steps and time, and knowing that the staff are being held accountable and they know I'm checking it's been a game changer.
And Damien, in overseeing two separate facilities as well in the sterile processing department, do you find that it helps with consistency in actually completing and in kind of training your staff on how to do these?
Yes, it does. It does two things. It allows that consistency. That's absolutely true. So, when I float, and I have staff that float from department to department or from facility to facility, that they're not coming in and going, well, they're doing it over here this way, and yet you're doing it over here this way. It's one way for all my facilities. So that's really nice to have that consistency in how we document, but also, again, the why, what we're doing. But it allows for that variability where if I may have different pieces of equipment. So at one of my facilities, I have one piece of equipment that's unique there, and it has its own log and its own database. And then I have another piece of equipment that does the same thing, but it's just different because we bought it at different years and different times from different manufacturers. So the program allows me to have standardization, which I like, but also that variability, which is also important because, not all facilities are created equal.
And Jeremy, how about you? As far as like life safety and making sure everything on the facility side is done correctly, do you find that this system versus traditional paper helps with consistency on those checks as well?
Definitely. Like we were talking about before, it eliminates the different users kind of coming up with their own way to do the same log. It gives it a standardization. I mean, even across the company, several other facilities that we know that are using it, the digital logs are also doing the same logs that we built from scratch. So you can go from center to center if someone has a question or has a question about like their generator, how that log runs through. It's simple to run them through the whole steps. And just with the life safety stuff alone is crucial for that standardization of everything.
Well, awesome. Thank you, guys. Is there anything else you guys want to talk about as far as traditional versus digital tracking, or is it okay to move on to the next topic?
No, I mean, I think the thing that I want to share with, and again, I have a wide variety of staff, so I have 44 direct reports, and different education backgrounds, different ages, different generations. The one thing about this is, some people in the beginning were like, oh, great, another change, or oh, we're going digital. It was relatively easily adopted by all my staff members, no matter what, if they're a Gen X, a boomer, a millennial, it didn't matter. They actually adopted this very easy. So it is intuitive to use, and it's one of those things that I think they realized that it saves a lot of time. The one thing that a byproduct that I didn't realize, we actually got rid of a workstation we had a bunch of paper documentation for. So we had different binders and different way of recording things, and we kind of had one area where we tried to keep everything, but it always migrated around. But now that I just have a tablet in that area, that workstation's been utilized for something else now. So it actually freed up workspace for us, and that was a weird byproduct that happened in our department.
And Jeremy, anything else you wanted to touch on?
No, just I agree with Damien. I mean, definitely through the the generations, everybody's accepted this. It was a little rocky at first, just because it's something new, and that's pretty much anything in the healthcare facility. But after a few months of it, everybody kind of got on their little own with it, and it actually ended up making more logs and more little standards and trainings and stuff like that to do on it. And everybody really enjoys it now.
Awesome. Well, I'm going to thank both of you guys, Damien and Jeremy. Thank you so much for talking about the challenges and your thoughts. And I'm going to turn it over to Mr. Brandon Coombs, who's going to be talking a little bit about one of the tools that you can definitely use.
Yeah, thanks, Jeremy. Thanks, Damien. Really appreciate it. You guys hit on a lot of, you made my part really easy. And thank you for everybody that took the time to listen to this webinar. The beauty about hearing both Jeremy and Damien speak is they're at both ends of the spectrum, right, as far as size of facility. And what we hear a lot from our team hears every day is, well, we're just a small 1 OR ASC, or we're a huge hospital and this would take forever to implement. Well, now you've heard from two end users from both ends of the spectrum that it's for everybody. And I'm going to go over a few points to show you exactly why. And what takes up a lot of the time in most facilities, and as you can see here on the screen in this slide, is checking those binders, or like we say, having binder parties. You guys have all had those. Organizing your audits, your copies, and your reporting, like Damien spoke about, like going between hospitals or facilities. That's time. Or for a lot of you, you have to jump on a plane to go to the different facilities if you're a regional director or for all of the leadership. And in no matter the size, the corporation, I've been in hundreds of facilities on-sites across the country, and there's three main pain points that I find in all of them. And again, Damien and Jeremy touched upon most of these, but the first being, hey, let's take Joint Commission, for example. They're the same standards, but every facility that I go into that has the Joint Commission as an accreditation agency has a different set of logs. So using a digital solution gives you the opportunity to standardize, right? And say, hey, here's the skeleton, and like Damien mentioned, no two centers or facilities are the same. Different ORs, some do GI, whatever your specialties are. That changes, yes. But all of your infection control, all of the skeleton logs are the same. So that's the first pain point. And the second, knowing center compliance. At any given time, are you survey ready? Or are all of your centers survey ready? With our dashboard, you can know that from every single one of your centers that are using a digital solution. And the third, again, it was also touched upon, but it can be rocky at first, right? A new software, change. Not a lot of people like change, especially in healthcare. It's tough to tell a nurse that's been doing this for a couple of decades that, hey, here's an iPad, try something new. It's not the easiest. But how does Surglogs help with that and comfort that? We provide unlimited customer care and in-services for your staff. Some centers take 2 weeks and they're ready to go. Some take 2 months. That's okay. We're there to help out as much as we need to. We have a customer care department that's there for you and your staff. That's their sole job, to ensure that you guys could get provided the support. And we have a chat that's available both on the mobile application as well as your desktop. And our team has a KPI built in of under 2 minutes, and their average response time is 42 seconds. And to us, that's paramount in healthcare. When you guys are focusing on patient care, you need an answer, and you need an answer now. You don't need to submit a ticket. It goes to an IT department. In 48 hours, you might get a response. No, you need a response now. So these are the 3 main pain points. And again, Damien and Jeremy did a great job as end users explaining how that's actually affected or helped their facilities on a day-to-day. And what you guys might be thinking is, well, how can this change, and what is the big difference? Right? Well, by using a digital solution, or opposite, by using paper and moving to a digital solution, you're saving a bunch of time. And as end users, your clinicians, your DONs are going to be very supportive of this. They already put in enough time for patient care, right? Long hours, long days. Your storage costs. There have been plenty of times I've walked into facilities, and here comes the Staples guy with the reams and reams and reams of paper, right? And that's a monthly cost of paper, toner, storage costs. You guys are all nodding your head yes right now, because all of you have this. Accuracy and peace of mind, which Damien and Jeremy talked about, right? Doing something with pen and paper, if you're like me, your handwriting's perfect. That's sarcastic, but it's all over the place, right? And you have meat orders. They're always on time. You're getting pinged when things are due. And again, a perfect example was the filtration system that Damien has within his hospital. You don't want to know the day before that you have to replace that. We let you know 28 days in advance. So same thing with supplies, medication. So these are some great benefits as far as, moving from paper to digital. A lot of you are also asking that are very business minded. Well, what are your quantitative metrics there at Surglogs that can help us? Right. Well, we took that and created a couple of use cases within our ASCs. We have a 1 OR, a 2 OR, but you can see in these slides, and not to get too detailed, but it can save you hundreds or thousands of dollars on every month, right? Depending on the size of your facility. But again, I mentioned that the paper, the toner, the storage, that adds up. So those quantitative metrics are extremely important. And for business-minded people, how much money is this going to save me? Well, it's going to save you labor, time, your paper, your toner. All of these metrics equal a lot of money. So with that being said, you're finally asking, well, why Surglogs, right? Our digital solution is completely customizable. You're not stuck to a specific template. Again, we're a mobile application as well as a desktop application, right? So your team can walk around with a tablet and not have to transfer information or log into a portal or go into a website. So it's very convenient. Your email notifications, you get pinged on daily notifications depending on the frequency of your logs, and you get automated reminders. You can set the permissions of each individual user. As Damien mentioned, he has the same users at different hospitals. One may be a different user setting at one hospital than another. You can do both of those within our system. Also, a lot of you leadership have to report or take reports and roll them up on your end of month reports or what exactly is happening with our logs. We have auto exports that are sent out on the frequency of your choice automatically to your email with a hyperlink, so you can roll those reports up. You can create nice graphs from Excel, whatever it is that you need to do to provide your direct reports with your information, we can supply that for you. So at the end of this webinar, our goal, folks, is we want to be able to have the opportunity to show you how we've done this in hundreds of ASCs and hospitals around the country. And not only just hearing it from Jeremy and Damien, but we want to hear your story. We want to show you, we want to have a quick discovery call. We want to set up a custom demonstration because, again, no two ASCs or hospitals are alike. We want to show you how we can do this for you and your facility. So given the opportunity, we'd love to hear from you and have a quick discovery call. And from there, I'm going to turn it back over to John, but I do want to give one final thank you to everybody on the call today, including Damien and Jeremy and John. You guys have been great. So thank you so much, guys.
All right, well, thank you, Brandon, and thank you, everyone else. I'm actually going to turn it straight back to Laura for questions. So feel free to visit us at surglogs.com to set up your demonstration if you are interested in this platform. I'll leave the slide up so you guys can have access to it while we answer some questions. So Laura, the floor is yours. Thank you.
Thank you so much for that fantastic presentation. We'll begin today's question and answer session. Please submit any questions you have throughout the webinar by typing them into the Q&A box that you see on your screen. The first question that we have here today is, what do surveyors think of digital documentation?
So I'll start that one off, and then I'll pass it over to Damien or Jeremy. And so some of the feedback we've gotten from surveyors, especially from the Joint Commission, are they love the ability to, instead of looking through tons and tons of binder, trying to find pieces of paper that match up with exactly what they want, it's really easy for them to search within our system and find the exact day in the exact log that they want. So they get the information they need really quickly. And one specific point of feedback, as all of you guys know, we have COVID going on right now. One of the surveyors that went into one of our centers didn't want to actually touch all the paper. So having the ability for them to download the application and have it on their own personal phone so they didn't have to go into like the individual facility and touch everything everybody else had been touching, they could use their own personal device to look at everything within the center. So that was a big one for them. And Damien or Jeremy or Brandon, if you have anything else to add, feel free to do so.
I can jump in on this one. This was one of those things that was, we were really going through the flow, and then we had our Joint Commission come through, and I was sitting down with the life safety guy, and I ended up setting, my laptop up there and asking him what he kind of wanted, and he's like, I was able to pull the stuff very, very quickly, specifically what he wanted. And he was kind of giddy at first, like, ooh, this is going to be fun, and then he actually fell in love with it being digital, just for the simple fact of the ease of it. Like I was saying before, it took what we'd normally spend half a day just going through paperwork on. It took it in about an hour, 2 hours, and then we were on our walkthrough.
Yeah, exactly. I mean, I honestly have not had a survey with using digitized logs or Surge logs yet. However, like I said, I'm in the mock survey mode, so I've got our corporate audit teams and our local facility regulatory IP, environment of care rounding that's going on monthly. Because we are in our window, and they are all, again, they came in, they saw, they got what they need, and they moved on. So they're excited for it too. What's nice is we're actually starting to share it with other not share it, but share the knowledge with other departments, like our endoscopy department, who's part of peri-op services, other sterile processing departments in our system as well. This is a system-approved product, so they have access to subscribe to it as well too. So it's nice that we're not only just keeping it here, we're actually starting to spread the knowledge of digitizing really does make the audits and the surveys go much better.
Perfect. Thank you so much for going through that with us, and that will be super helpful for our attendees. The next question we have here from one of our attendees is, do all of the digital platforms have the reminders that you were discussing during your presentation?
I'll take this one. While I can't speak for other digital platforms, as unfortunately I haven't had the chance to interact with many of them, I can speak for Surglogs, and Surglogs 100% has those reminders and creates that workflow. So it's going to remind you of any missed logs, any upcoming logs, expiring medication, and for anything that's longer than a monthly check. So for example, your quarterly, biannual, annual, every 2 years, all that good stuff, those will all have reminders. And Brandon, if I'm forgetting anything, you can add in on there as well.
No, I just want to make sure we are answering the question properly. If that's a comparison to other digital platforms as far as outside of Surglogs or within our individual modules, but there are reminders on all of our modules. So given the frequency, we can help out with whatever the frequency of the log is. And like John mentioned, the big ones are, those quarterly or annual checks that everybody's using Outlook as reminders, or Excel, everybody's favorite, right? Well, hey, guess what, guys? Excel does not jump out at you and say, hey, your filter is about to expire, or you have an annual inspection coming up. So yes, absolutely, those notifications are on our modules, 100%.
Yeah, I totally forgot to mention our credentialing module, our vendor contracts module, all will have reminders built into those as well.
Got it. Thank you so much for that clarification. Another question that has come up here is, can you share the name of the tools that are being used to digitize your logs?
Yeah, so Surglogs is the overall platform, and then inside of it we've got different modules named surgical logs, which is most of the documentation, pretty much your digital version of the binders that you have right now. Credentialing, which handles staff credentials and nurses license. We have vendor contracts, which handles contracts with outside vendors, as well as reminders for any automatic renewals. And then we have a narcotic logbook, which is a DEA compliant permanent record of any narcotics transactions within the facility. And our procedure logbook, which tracks procedures.
And John, I want to touch sorry, Laura, I just wanted to make sure that we answer it thoroughly in case we're not understanding the question, but there's not a specific tool we use to actually digitize the log. So we have a team that digitizes every center's log because we want it to mirror their logs exactly. So for like Jeremy's logs, he sent over to us, our team that digitizes every single one of those logs, makes sure that it looks exactly like their staff is used to. And the same as Damien's logs were different. So our team takes that paper log and mirrors it digitally. So we don't have a tool we use to like run it through a system. We have individuals that take the time to ensure that the log is exactly what they're used to seeing.
Got it. That's helpful to know. Brandon and John, I have another question for you. Do you have any endoscopy centers using the platform?
We have several, Brandon.
Yeah, so we are partnered with a large endoscopy organization called Physicians Endoscopy. So we are very, very well versed with endo centers all over the country.
That's fantastic. I know Physicians Endoscopy is a great organization, so good to hear that you're working with them. Now, one more question on the log side. Is the system compatible with CMS's system?
So to clarify, our system is completely customizable, so we can build it out if you're CMS deemed or you're doing your surveys through CMS themselves. Yes, we can make all of our logs compatible with CMS. As far as integrating directly with any CMS software, that's not something that we do currently. And Brandon, if you have anything to add there.
No, I think the simple answer is yes. Are we accepted by CMS? Absolutely. We're accepted by all major accreditation agencies that are out there. So the answer is yes.
Got it. That makes sense. And now a question for Damien and Jeremy. How long did it take staff to learn how to navigate the electronic tool?
Well, I'll go ahead and start this. It didn't take them too long to learn the tool. Again, the key was I did, as we do a lot of training, is I put it in the hands of some capable leaders in my department, team leaders, at various shifts and times, and started that knowledge base. So we dipped our toes in the water, got a couple of what I call super users, people to use it. But again, like I said before, we're all used to using apps nowadays, and we're in the digital world. We just needed to get out of the 1980s in our sterile processing department and do this. So the staff, once they got it, they learned it really quick. Again, it took a little bit of time, I'd say just a couple of weeks for them with follow-up to know that this is something that is part of their daily routine. But the fact of actually learning it, it took a session or 2 sessions to learn it. It's very intuitive.
I completely agree with you on that, Damien. I mean, it went very quick. There was the old schoolers that loved their paperwork that kind of took them a little bit to change. But once they started playing with the system and actually getting used to it, they actually went and actually was bringing me more stuff to enter and get set up just because of the ease of it. And they, it has become just a standard where they walk in, they pick up a tablet first thing in the morning, they start going, and it gets done throughout the day.
That's perfect. I love you said that because, yes, one of the other byproducts of this is my staff, I thought, and my leaders thought that we had all the logs covered. My staff once they were using Surglogs, they were now finding other things that we did not find or did not discover. We didn't know we had a log for this thing, or we didn't know we should have a log, and they got very inquisitive, and they wanted to put more and more into Surglogs so that we were doing things right, but we're also making sure we're accurate.
That's great to hear. The next question I have, a few attendees are wondering about whether the templates are pre-populated. Could you talk a little bit about whether the templates are populated with information and, if you have templated logs for facilities that are just getting started and don't necessarily know what they need?
Yeah, so I'll take this one. So we do have the option to pre-populate the individual templates. So if you are a center that is just starting out and you are AAAHC, Quad ASF, TJC, we've built out templated centers based on centers of ours that have recently passed their surveys. So you can start from a great foot knowing that all of these logs have been used in a situation that has resulted in a passing survey. So we have those that we can give the centers that are just starting out. And as far as pre-populating the information, once you fill out a log once, it can populate the information based on the last entry. So for example, if you're doing a really long inventory type log for your crash carts, your MH carts, after all of those, it's going to populate and pull all of those medication expiration dates and their lot numbers into the next entry. So we'll pre-populate that information for you as well to make it a little bit easier for your staff when you're doing those longer type logs. And then Brandon, if you had anything to add.
No, I think you covered it. And that's a great question, because where we find we're very helpful is a lot of administrators or people starting out a new center, like, hey, I need direction, right? Like, what logs do I need? So we have those already digitized, no matter your accreditation agency. So whether you're a center that's been around for 20 years or a center that just broke ground and is opening doors in 3 months, we have a solution for you.
Thank you for going through that for us. The next question I have here from the attendee is, how do I convert my process to a digital one?
Brandon, I'll let you take this one.
Yeah, contact us and we'll take care of all of it. And that sounds, I don't know, maybe a little confident, but how do you convert it? We do all that for you. So we mentioned a little earlier, so there's a few different options, right? And a lot of centers like to see, we have a list of logs, per accreditation agency that you can compare yours to. And then the actual conversion process, you could gather all of your log templates and simply scan them and email them over to us, and our team will create you your own virtual center, which will include your digital logs, and then we'll have a discovery and a review session to ensure that all of those are mirrored exactly how you and your staff need them. We also provide a tablet for your center, so you're not only getting comfortable on the desktop editing, reviewing the logs, but as your staff would need to actually review them, as they would, in a use case, pick up the tablet, and we make sure that it's all taken care of. So we do as much hand-holding as we need to ensure that conversion from paper to digital is well versed, and everybody's under a complete understanding. And we don't stop until the comfort level is where you want it to be.
That's helpful to understand. And now I have another question here from an attendee. What is the biggest advantage of using a digital system?
Damien or Jeremy, you guys want to take this one?
Yeah.
Sure. I mean,
Yeah, I
I'll,
can
I'll,
jump on this one. Go ahead.
yeah, I think we both can. Yeah, I think we both can tackle this. I mean, I think the biggest advantage of the digital system is just that: is everything's at my fingertips. And again, I have, as leader, I have that confidence that my team's doing the right job just by going in every morning, creating my standard work, where I just check my logs and seeing where they're at. Follow up if I need to follow up. But again, I just don't worry. It doesn't keep me up at night going, did they complete something? Did they do something? There was a story I can share real briefly that there was a facility that wasn't mine, but it was in my previous healthcare system that, you know, when a unfortunate event happened and the regulatory people started coming in really digging into processes and practices, they kept finding discrepancies in logs or logs that had missing dates and times or missing names. And I know the staff did this stuff because I saw them when I walked through there. They were doing the work, but it just wasn't documented. And as we know, if it's not documented, it doesn't exist. It didn't happen. And that was just so painful to go through, not only as a professional in this industry, but also knowing that the staff did the work, but we couldn't prove it. With the digital platform, that takes that away from me because I can see it digitally, and if it's not, we can follow up and get it, you know, with the person and get it updated. And that, you know, that peace of mind is really what's the big difference for me.
Yeah, I completely agree with that. I mean, what's really been nice, I mean, through the digital, you know, doing everything digital, I've even got my vendors on a standard that goes with the life safety codes or the EOC codes that really make it exactly what I need. Instead of their documentation being kind of vague on some areas, it makes it specific. And that's what just the whole digital side's made it easy, especially for tracking and everything else. And the reminders, I love those.
Well, that is all the time we have for today. I want to thank Damien, Jeremy, Brandon, and John for their excellent presentation and Surglogs for sponsoring today's webinar. Enjoy the rest of your day, and we look forward to having you join us for future webinars.